Well, a lot of people like to get a healthier start to the new year, and today we have Dr. Corry Clinton from Lima Memorial Health System and Northland Medical Center here to talk about how to establish a better routine in order to accomplish those goals. And first of all, thanks for joining us, Doctor. Can you tell us what primary care is really all about?
Sure. So primary care, we do a number of things. We deal with chronic disease management, high blood pressure, diabetes, some heart problems, things like that. We deal with more kind of same day or kind of problem visits. If you're starting to get some bodily pain, some knee pain, if you're sick, things like that, we manage that. And also we do a lot of preventive care, making sure that we're up to date on preventive things like colonoscopies, mammograms, checking blood pressure, things like that, trying to prevent problems before they get big.
Well, usually we think of eating better, getting more exercise, maybe even trying to lose some weight when it comes to general medical suggestions. But how can a primary care provider help in determining the best plan of action for someone?
Certainly. Those are all easy things to say and harder things to do, right? It's very easy to say, like, well, you should eat better, maybe you should lose 10 pounds. But figuring out what's an appropriate goal for a person and what's a safe and reasonable way to get there, those take a bit more thinking, right? So, some people want to, have a better fitness routine, do more exercise. Well, some people might have certain limitations. They might have arthritis. They might have things that cause them problems. And figuring a way to overcome those boundaries and to accomplish what you want to accomplish while still dealing with the, issues that you might have in a safe way. So a primary care doc can help figure out those things for you.
So what can somebody expect on their very first appointment when they come in to see a primary care provider?
So often in the first appointment, a lot of it is really just information gathering. If you have a number of chronic diseases and medications, taking a time to sort through all of that and make sure that everything is working for you and that the treatments are, what would be the best thing for you. Often when somebody comes in their first visit and they say, I'm having, say, this back pain, and we focus on that. Sometimes people come in and they just want a preventive visit to make sure that we're up to date on everything. So really it depends on kind of what you're coming in with. So I would recommend, if you're having your first visit with the doctor, have in your mind, what is it that I want to do? Like, is there a problem that's bothering you? Is there a goal that I'm trying to reach, so we can tailor the visit and focus on that?
We've got a number to put up on the screen for folks who are watching right now. If they want to set up an appointment, what do they do as far as you're concerned?
They can just call the phone number down there. There's a number of people taking patients. I'm always taking patients. I'm up in North Lima. If you want somebody by the hospital, there's folks at the hospital taking patients. We have people out of town, Kitten, Wapak, all over. So just call the number and we can connect you with somebody that'll work for you.
Thank you so much for your time today. Dr. Corry Clinton is our guest, and we'll be back with more right after this.